For quite some time, health insurers have been navigating rough and uncertain seas financially. And for insurers operating in both Medicare Advantage and the Marketplace specifically, 2016 is setting itself up to be no different. That said, this year is going to be unique, given the convergence of two major forces that will create what can only be termed as a perfect revenue storm. So just what are these forces bearing down on payers? Well, first off, we have round 2 of EdgeServer reporting for the Marketplace. In round 1, we saw 195 plans lose money by having to pay into the premium stabilization programs. We also witnessed plans who might have received payments back, but received considerably less than they forecasted, leading to some significant revenue gaps. These plans could have lost out on payments for any number of reasons, including a lack of EdgeServer submission visibility, non-prioritized exception management or a complete lack of exception management workflows, and/or inaccurate risk adjustment analytics. Throw in the fact that CMS is only paying out 12.6% of risk corridor payments, representing a $2.5 billion shortfall for insurers, and it's easy to understand the financial woes plaguing Marketplace participating payers. Now, these issues get compounded by the other aspect of our perfect storm. That's right, it's everyone's favorite topic, the ICD-10 transition. Many health plans make the statement, but we've been preparing for ICD-10 for a long time. We did our testing in advance and we don't have any issues. The truth is, as an industry, we have only begun to scratch the surface of what the impact of the ICD-10 conversion means to health insurers, and these types of statements are premature at best. The real issue for Medicare Advantage and Marketplace plans is the impact of the shift on HCC codes and subsequent risk adjustment payments. There are thousands of ICD-9 codes that don't have a one-to-one translation when crosswalked to ICD-10. Plenty of room for some very expensive HCC errors. And if your risk scores decrease, so will your revenue. Planning to address using GEMs or general equivalency mappings? They're insufficient in really addressing coding complexity. Plan to address gaps and errors through chart reviews? They can run insurers upwards of $70 per review. Extrapolate that cost over the volume of claims that any given Medicare Advantage or Marketplace plan generates, and it gets very expensive very quickly. So 2016 is shaping up to be a monster storm. So what are the tactics that health insurers can put into play now that can lead to revenue success in the face of these challenges? Well, at Edifecs, we see health plans overcoming these challenges through 2 primary strategic capabilities. First, plans must have the ability to prioritize their encounter exceptions based on revenue impact and be able to resolve errors and resubmit using integrated workflows. Approaching exception management through the use of spreadsheets and other static, non-workflow-backed methods only serves to exacerbate issues and definitely doesn't lend itself to improving plan revenue integrity. Secondly, preparing for the ICD-10 shift does not necessarily correlate to successfully managing the impact of the shift. Without detailed analytics that enable plans to sense and respond quickly to coding anomalies and identify areas where there might be potential shifts in revenue, plans are, to a certain degree, flying blind. Edifecs has been a trusted partner to health plans for 20 years, and we employ a mix of both strategic consulting services combined with market-validated software solutions. We're privileged to count small regional plans, the majority of the Blues, plus many large national plans, including MAOs, as our valued clients, and we're ready to help your organization as well. But the longer you wait, the further behind the 8 ball you're going to be. For your Marketplace plans, April 30th will be here before you know it. If you lost revenue last year or missed your revenue targets and want to avoid a repeat performance, then you quite literally cannot afford to wait to make improvements. Medicare Advantage. The CMS advance notice and call letter has come out, and CMS is calling for a 50-50 split between WRAPs and EDPS. So now you're submitting and reconciling in both formats, with them each being weighted equally. The point here is that having the ability to address HCC coding inaccuracies and prioritize exceptions based on revenue impact has real demonstrable bottom line impacts. And if there's one thing we're certain of, is that choosing to not address these issues or choosing to address them in an uncoordinated, patchwork fashion will certainly lead to revenue being left on the table. And in today's market, that's not a wise business decision.